I want to have a debate about the broken healthcare system and why we have this ridiculous system. The idea that we're going to associate the murder of a health executive with Medicare for all, to me, does not bring us anywhere closer to Medicare for all. We're not going to shoot our way to universal healthcare. Ridiculous kind of performative, I don't know what you'd call it, theatrics, heroics, I don't know.
If you are comfortable and have good healthcare, it's easy to say the system is broken. The system's not broken. It's corrupt.
It's Jordan. I am in Flint, Michigan, East Palestine, Ohio,
Tumwa, Iowa.
Please support the only independent outlet on the ground covering what the corporate media covers up.
Hey, it's Jordan with Status Coup. The murderer of UnitedHealthcare CEO Brian Thompson has been charged with murder in Manhattan. Luigi Mangione, 26-year-old from Pennsylvania. And based on information coming out, it seems like he has lived with a pretty debilitating back issue that severely impacted his life, led to him having surgery recently. And according to reports, that surgery afterwards, he stopped talking to his family and became estranged to the point where his family reported him missing. Let's give you details. I, by the way, have a personal, not connection to him, but I do have life experience of my own with chronic back pain, including 2 surgeries. So I might be able to illuminate more on this. Let's give you some more of the details here of still moving parts. Again, he was charged with murder in Manhattan after being found in Altoona, Pennsylvania. Luigi Mangione, a University of Pennsylvania grad, comes from a well-off real estate family, prominent in their Maryland community. He was raised outside Baltimore in Towson, and his family owns 2 sprawling country clubs, a local radio station, and several other real estate holdings. In the weeks leading up to the shooting, he became estranged from his family and friends, according to law enforcement sources. Mangione's mother reported him missing on November 18th, possibly from a home in San Francisco, where he lived for a time, and reached out to his peers as they tried to track him down. Give you a lot more information about his debilitating back issue, which, again, he had surgery for. We don't know if there were denials involved from the insurance company. At this point, I don't know if he had UnitedHealthcare. This is from the Independent. The suspect in the murder of UnitedHealthcare CEO Brian Thompson reportedly went missing and cut off contact with family and friends last month after undergoing back surgery. While the motives for the attack are still under investigation, new details are emerging as to his health issues. The Ivy League college graduate suffered from a debilitating chronic and underwent major surgery for it in 2023, a friend told the New York Times. That chronic back condition, according to reports, was totally going to mispronounce spondylolisthesis, where one of your bones in your spine, called a vertebrae, slips forward. It could be painful, but there are treatments that can help. It may happen anywhere along the spine, but it is most common in the lower back. RJ Martin, a friend of Mangione and spokesperson of Surf Break, a co-living space in Honolulu, where Mangione lived for about 6 months until April 2022, told the newspaper that Mangione had moved to Hawaii in a bid to get healthy, as healthy as possible in advance of the operation. His spine was kind of misaligned, Martin said. He said his lower vertebrae were almost like a half inch off, and I think it pinched a nerve. Sometimes he'd be doing well and other times not. The injury hampered Mangione's ability to surf and also took a toll on his romantic life. After taking one surf lesson, Martin recalled to CNN that Mangione ended up in bed for about a week with back pain. Mangione also once sent him a photo of an x-ray of his back, which Martin said looked heinous, with just giant screws going into his spine. And here is that photo. So you could see at the lower end, looks like 4 screws in his spine. And not to compare notes, but just so you know, kind of my story involving my back. For those of you who are new here, some of you who've been with Status Coup for a long time know I had really debilitating back pain at the end 2016, 2017, my back hurt. I was on the road covering the presidential campaign. Then I was at Standing Rock, where I slipped many times. I was seeing a chiropractor in 2017, which wasn't helping. I asked them, should I get an MRI? They kept telling me no. Well, stupidly, I listened. And then when I got the MRI, I realized that my my disc in my L5, which is the last disc down there. If you see right down there to that two healthy discs, and then my L5, you see that little jagger at the end of it that is on my S1 nerve, the sciatic nerve. It was basically squeezing my sciatic nerve. Here's another one. Healthy discs above, and then that piece at the end is squeezed on my sciatic nerve, which was causing severe muscle spasms going down my leg. So beginning of 2018, I started having severe spasms in my hamstring, my calf. My whole left foot was completely numb. I went to the doctor in February of 2018. They do the test where they bang your knee and your Achilles to see a reflex. I had no reflex on my Achilles, and my whole left foot was numb. Doctor says, if you don't get surgery ASAP, you're going to lose feeling in your left foot permanently. They believe that a piece of my disc, because the L5 disc was squeezed on my sciatic nerve for so long, they believe a piece broke off. Trigger warning, if you get nauseous real quick, look away. I'm about to show you the piece of disc that they took out of my back during the surgery. It looks like a long chicken finger of sorts. So that's what was stuck in my spinal cavity, causing excruciating pain, causing numbness in my foot. I had to get a follow-up surgery the next year, because even after post-surgery physical therapy, my foot, I wasn't recuperating well enough, and I still had significant numbness in my foot. So they went in, they cleaned up some scar tissue, some calcification, they called it. To this day, I'm not in severe pain like I was, but I still have a little numbness in my foot, my hamstrings, my calves still tight, because I barely have a healthy disc left. This is a more recent MRI. You can see the healthier discs. And then at the bottom, you see that lower disc count, if you could circle around it. There's basically any disc left in it. So eventually I might need to get a spinal fusion. But I tell you all this not for pity, although pity's nice occasionally, particularly since we are one of the only outlets still that go routinely on the ground across America. And I'm doing it with a bad back. But because pain in general, but back pain in particular, oh my God, before that surgery, I literally could only lay in bed face forward on my chest with my head hanging off the bed. I could barely walk. At however old I was, 30, my mom had to help me to the shower. I had severe spasms. So whatever Luigi Mangione was going through, which sounds different than what I was going through, but could have been just as severe and probably more chronic for him. More details will come out. It is really unbearable, chronic lower back pain. And for me, I was lucky. I mean, I did get hit with a severe bill after 2 surgeries, even with health insurance. I haven't paid it off fully, but it was about $6,000 between 2 surgeries with insurance. However, I didn't have delays. They said, you need this surgery, and I had it. I think that was Friday at the doctor. I had the surgery the following Monday. So they got me in real quick, and there were no delays. The surgery went well. The treatment, I had physical therapy after. My copays weren't that much. So I don't know what exactly he went through as far as treatment, as far as denials, whether he had to wait for surgery, whether they denied him surgery. I'm sure we'll find out that information. But back pain is serious, and it can affect your mental health too, for sure. So let me give you more details of his situation here. So this is from the New York Times. Martin said that when Mangione moved into their Honolulu space in 2022, he mentioned his back issues and said he was hoping to get as healthy as possible in advance of a major back operation. His spine was misaligned. He said his lower vertebrae were almost like a half inch. He said his lower vertebrae was almost like a half inch, and I think it pinched a nerve, something he'd been doing well and other times not. But he said he and others in the community came to understand that the pain was no small matter to the 26-year-old man yearning for a normal lifestyle. Shortly after he moved into surf break, Martin said, Mangione took a group surfing lesson and suffered such debilitating pain that Martin had to switch out his mattress. Later, he said Mangione confided that he had no relationship because he knew that dating and being physically intimate with his back condition wasn't possible. I remember him telling me that, and my heart just breaks. I won't give you TMI myself, but I will say if you have severe back pain, certain types of physical activity that are enjoyable to all of us are not so enjoyable, particularly certain motions. I'll leave it at that. Friends said Mangione lived with significant debilitating back pain and underwent surgery for it last year. RJ Martin, the co-founder of the co-living community in Honolulu, said when he met Mangione in 2022, he was smart, accomplished, and an upbeat engineer who had come to Honolulu to work remotely. Martin had just founded a co-living community on the 40th floor of a high rise. So clearly, this guy was suffering for many, many years. He eventually got the spinal surgery in 2023, but when Martin asked via text how it had gone, Mangione had replied, long story, and did not elaborate. They last texted in April, he said, and promised to catch up via phone, but did not. Yo, you awake? Martin said he texted in late May. Then on June 23rd, where in the world are you? There's more details of his manifesto. This from the New York Times. The 262-word handwritten manifesto that the police found on Luigi Mangione begins with the writer appearing to take responsibility for the murder, according to a senior law enforcement official who saw the document. It notes that as UnitedHealthcare's market capitalization has grown, American life expectancy has not. Quote, to save you a lengthy investigation, I state plainly that I wasn't working with anyone, he wrote. The note condemns companies that, quote, continue to abuse our country for immense profit because the American public has allowed them to get away with it. The American public has allowed them to get away with it. Now, I don't know if he had United Healthcare. I don't know if he had denials for surgery. I don't know, for back pain, I could tell you I did chiropractic before surgery, did physical therapy before surgery. I did massages. The healthcare system is a mess. So I did acupuncture. Some of it was covered, a lot of it wasn't. And the stuff for me that was covered, I still had, high deductibles to pay, copays, co-insurance, and all the hidden bills they throw your way. So we don't fully know yet what his situation was, if he was denied for surgery, if, how much his pay was. He's from a wealthier family, it seems. So it doesn't seem like necessarily he wouldn't have been able to afford it. But just because you're wealthier does not mean you don't have a conscience. Just because you're wealthier, sometimes, in some cases, wealthy families, you're still, they're not giving you unlimited money or, a blank check for things. So I don't know how this affected him. Maybe, by all accounts, he went to prestigious private schools in the Maryland area. He was very smart. He was a valedictorian, I believe, either high school or college. So this was a smart guy. This was an intellectually curious guy, is an intellectually curious guy. And according to his online account, he had read several books about back pain. So this is something he was not only dealing with physically, but he was also looking up and researching a lot of this. So he said, again, he said the American public has allowed them to get away with it. And to remind you, obviously, this became extremely personal to him, to the point of committing this violent crime. The handwritten manifesto found on Mangione contained the passages, quote, these parasites had it coming, and I do apologize for any strife and trauma, but it had to be done, according to a senior law enforcement official. So I want to show you something else, and this is from someone on TikTok who did their own research. I've looked into it myself, and it checks out, so that's why I'm showing it to you. I believe it's accurate. But Mangione apparently himself his family owned some long-term healthcare facilities, some long-term care facilities, including rehabilitation. He volunteered at these places, so I don't know if experiences there had anything to do with his hatred of the insurance company. We don't know, but his family is wealthy and owned for-profit nursing facilities. Let me play this.
Introducing the Mangione family. Now, the Mangione family actually is the head of a group of organizations that are privately held nursing care facilities, and it's called the Lorien Group. And if you look at the Lorien Health Services About Us page as of today, it says a family-owned and operated organization founded by and conducts itself based on strong family values. But if you look just a couple days ago, it looked like this. That's right, folks. Just a few days ago, it said when Nicholas and Mary Mangione founded Lorien Health Services, they set out to provide Maryland seniors with pride and dignity, yada, yada, yada. It's very interesting how that just changed, isn't it? But how do we know who really owns all of these facilities, and how do we know he's related to them? Now, doing a fair amount of research on these nursing facilities, I've learned that since 1977, they've grown to have at least 9 long-term care and rehab facilities all across the state of Maryland. They also have expanded to add a healthcare services company, and they invested a ton of money in buying Turf Valley Golf Resort, where they have tons of weddings and conferences, and they also host hundreds and hundreds of dinners for healthcare and pharmaceutical representatives. No correlation, I'm sure.
So his family owns Lorien Health Services that owns 9 facilities. He volunteered at a few of them by all reports. I haven't looked independently in it, but that person on TikTok says there were bad reviews for some of them. No idea if his volunteer experience there had anything to do with his obviously hatred and disgust with the healthcare system, but he sure seems to have a lot of thoughts about United Healthcare. Sure seems to have a lot of thoughts about United Healthcare. I want to show you this clip. This is from News Nation, a doctor who works in a hospital himself, basically expressing his disgust with the healthcare system, which you are seeing a whole lot more out there from actual doctors saying this system is rotten. This system is corrupt. Let me play you this clip of a doctor raising alarm bells.
We as doctors have been crying, screaming on the top of our lungs regarding how lots of insurance companies are denying claims on a daily basis. And ultimately, the bottom line is it's just that these issues have just resurfaced because of these incidents. But this has been going on for decades and years, and in fact, it's getting worse.
Well, that's the thing. Is it getting worse? And speaking of being clear, I want to be clear. Nobody's justifying violence, the killing of someone in cold blood in the New York City street, but it is highlighting these issues, to your point. What about it is getting worse?
Well, ultimately, here's the bottom line is when we as physicians order certain tests, whether it's for a patient going through chemotherapy or even something as simple as a mammogram, we're getting what's called a denial. This patient cannot get the mammogram unless you do something called a prior authorization.
Right.
And a prior authorization basically simply means giving the insurance company the ability to get back in the driver's seat and decide if they are going to pay for a procedure or not.
When you started, though, was that happening less? In other words, that's happening more now?
I think it's happening more now. I mean, I'm in my 20th year of practicing as a primary care physician, and I can remember way back when I was a resident how this was an issue. But now, we sometimes wonder as physicians, is it artificial intelligence that's the doctor, or is it people like us that are trying to advocate for our patients?
Well, check out my report from yesterday on United Healthcare's artificial intelligence scam that is denying patients 90% of the time for claims. You'll have your answer. It's increasingly artificial intelligence. That's a doctor in practice for 20 years. I also want to play you, sorry to make you nauseous, a clip from Pod Save America to give you the left, i.e., neoliberal response to this. They kind of, sort of are for universal health care, but give you every reason in the world why it can't work. Here's their response to this murder of the United Healthcare CEO, as well as them twisting themselves into human pretzels to tell you why this won't actually work, and getting the system and getting the root causes completely wrong.
There's a lot of like earned vitriol. Like insurance companies, some are better than others. Plenty play games, even break the law to try to avoid paying. We have a cruel and broken system. Like that's what we have. Like this guy, well compensated, is a tool of a broken system. This insurance company exists and benefits from a broken system. And like that to me, like I want to have a debate about the broken healthcare system and why we have this ridiculous system where half the people get insurance through work, which creates these incredibly convoluted and broken incentives, where we have publicly traded companies that exist to create a difference between how much they pay out in health benefits versus how much they recoup in premiums. Like their job is to maximize that differential. We built a whole system around it. That's fucking stupid. That is terrible. That causes all kinds of harms. But like the idea that we're going to associate the murder of a health executive with Medicare for all, to me, does not bring us anywhere closer to Medicare for all. We're not going to shoot our way to universal health care. And it ends up becoming a kind of vicious and negative and divisive debate, a debate we can win without kind of needing to resort to this sort of like ridiculous kind of performative, I don't know what you'd call it, theatrics, heroics, I don't know.
So let me correct the Pod Save America bros over there, because I'm pretty sure they have pretty damn good health insurance and make a lot of money over there to continue to elevate the status quo. If you are comfortable and have good health care, it's easy to say the system is broken. The system's not broken. It's corrupt. System's actually working just fine for the people that set it up to be corrupt. It's not a broken system. It is a corrupt system where we have a completely unnecessary, immoral middleman to put out severely inflated charges for no actual healthcare reason. It doesn't improve healthcare. It just goes to unnecessary middleman and CEOs. It's not a broken system or what he called a fucking stupid system. It's a fucking corrupt system that people like you continue to elevate. So, I mean, we're going to get more information that comes out from this. I'm sure we will get more specifics on what specifically was his personal experience with the healthcare industry, whether he had UnitedHealthcare, whether there was delays for his treatment, how much money they had charged him. Perhaps he had loved ones with experiences, friends with bad experiences. But either way, the media is going to try to quickly move on from this story now that he has been caught and charged. We will not. I'm going to do interviews with people that have suffered healthcare horror stories. If we could get the funding, please support us, statuscoup.com/join. We will go out on the road and cover this more. At the end of the day, we have a healthcare Hunger Games in this country. And unfortunately, it took the murder of someone to reopen the discussion, but I'm glad we're talking about it.